how can we empower? How can we create opportunities? How can we, take ourselves and be part of this answer and be part of this solution? What do you feel like are the biggest health issues that predominantly affect Black women?
Right now, we've looked and had limited amount of research that is in time that has been put into healthcare specifically aimed at Black women and what the racial inequalities are when it comes to specifically Black women. And so it's of recent that we're finding that the time is being placed on researching things specifically for us. And so what we'll find is that because of that limited amount of research and because of the limited amount of data points that are used when the research is obtained, we don't have lots of information. The CDC is now focusing on that, and we're getting some information, especially in my field with maternal morbidity and mortality, but the data is not there. Now, we do have a Black women's health imperative that's been around for 30 years, and the Boston University Medical Center has done the Black Women's Health Study that's been around. We've gotten data from that. But as far as the government really putting money behind those inequalities, hasn't been so. So the myths are out there that Black women, and they're all negative myths for Black women, exercise, Black women eat healthy, Black women go to the doctor, they work hard, and they are concerned about their health. But then you also find that a lot of the studies initially thought it was just genetics or lack of access. But then when you make sure to look at all of those factors and all things made equal, it's not lack of access in genetics. It has more to do with implicit bias and the structural racism. All that goes into that. And so when you look at just the typical Black woman who goes to work in the morning and has to deal with all of the regular things of the day. And so you've got the income inequality when you enter the office, you've got the implicit bias and having to be all of the things that we just spoke about recently. And so that low level of stress, people don't realize how that affects your body. And so now we have increased levels of stress, increased levels of cortisol, and what that all means. And so now you see your rates of obesity and hypertension and sleep disorders and all of that increases. And therefore, now you have more underlying chronic conditions, and those are not being addressed from the aspect of the inequality in healthcare that exists. Because we don't have the data specifically for us to improve that. And so I do, if anything, I'm happy that the focus is being put on just the racial health equality right now for Black women as a whole.
Yes, that's right. And Dr. Hamilton, one of the things you said, I think that always stands out for me is also on the system being able to recognize what the low levels of stress look like and what it looks like. Because a lot of times what you see in the patient-provider interaction, when a provider doesn't know how it presents in Black women and doesn't understand the context, is that these opportunities are missed in healthcare, right? To pay attention and to understand. And, I think, I know that what's important is, a lot of times we look at health and disparities. Like you said, we inappropriately look at the individual, even when we know there's not a difference in behavior. When it comes to these health conditions, it's the system, and unless we address the system, then anything that you do for the individual to empower them, which is still important, will kind of fall flat, right? And so we don't have a lot of solutions if we're only focusing the solution on the individual, because the system isn't set up right now to understand how different health concerns present, and also looking, just like we need to look at ourselves in parenting and in education, we have to look at ourselves as professionals and as a system for healthcare about how we perpetuate biases and don't recognize biases, and how a system isn't structured to help yet.
That's right. There was one other point that is mental health. And so we know that about 28% of the Black women who experience the unlawful use of deadly force, there have been mental health challenges as well. And so this is another area that we don't talk about a lot in terms of the ways in which Black women are presented. and responded to. But the data, I think the Washington Post just came out with a major report, and they were looking at Black women who've been victimized by unlawful use of deadly force. But within that group, they found that there was a larger percentage of Black women with mental health issues than others who had been, who were recipients of this unlawful use of deadly force. So that's another area of health that we have to talk about.
As a Black man, born to a 16-year-old mother who raised me well and having to live with a strong Black grandmother, I've always appreciated Black women. But to make sure as a whole that we're appreciating the whole person, that we don't look to them as a piece of a woman for a certain thing or idea or as an object or anything, but we're valuing the whole person. And we create environments that value them as whole people. Why does representation matter, and how is it most impactful for Black girls?
Yes. I don't have children, but for some reason, every space I go into, I always attract teenage girls. And so I try to be some type of source or, you know, just a sounding board, because a lot of times they don't want to talk to their parents or, you know, and so we have these conversations and these dialogues. So creating that sense of community, which we know is so important for Black people in general, but definitely for Black girls.
Yes.
And it's going to be important for those role models that they see to be people that look like them. And the number one way for us to improve our outcomes in healthcare is to have providers that look like we do.
Yes, that's right. Yes, that's right.
Those things into consideration, just the biases that exist and the low-level stress that exists on a daily basis, from just income inequality to housing inequality to the having to prove yourself every day and all that goes into that. I mean, you just have a low level of hypertension even when you go to sleep. And so how does that now affect everything that you do? So those Black girls become the Black women that I see. So now we have just the years and years and generations of the stress that causes health problems. And so it is really important for them to have a space and a place for them to be and accepting of who they are, so that we can change the narrative.
Yeah. We're going to have to do a better job training men in order to protect women from violence.